tell me a little bit about the opioid pledge. If somebody is listening and they're like, opioid pledge, it sounds like just a kind of a standardized thing, the way you named it. But maybe that's something that not every pharmacy is currently doing. So talk a little bit about that.
Yeah, so the opioid pledge was part of a Flip the Pharmacy change package. So we can talk a little bit more about that too. But with the change package with Flip the Pharmacy, they would give us a breakdown of what that month's focus was going to be on and different tasks that we could do to make the pharmacy more clinically focused. So one of those was to create an opioid pledge. And that basically means that it has some different bullet points that show what the pharmacy is responsible for and then also what the patient is responsible for. So it's laying out for the patient that if they're picking up an opioid medication, and this is for chronic opioid management. So if someone's getting a 30-day supply and they've gotten, I would say, 1 or 2 fills of a 30-day supply, that's when we're giving them the pledge. And that's outlining that the pharmacy is responsible for checking the PDMP. The pharmacy is responsible for making sure that the dosing is appropriate, that everything on the prescription is legally correct. And then it's saying exactly what we are expecting of our patients. So we're saying patients are responsible for keeping their medications from getting lost or stolen. They're responsible for not asking for their fill more than 3 days early. That's our cutoff. They're responsible for getting all of their controlled medications at one pharmacy. So we have, I would say, maybe 10 different bullet points that we have them read, and then they sign the pledge. And then they also sign whether or not they have a Narcan. And if they do not, we will always recommend to fill a Narcan on the spot for them. We'll take that e-care plan. We will scan it into the patient's documents or take the opioid pledge, scan it into the patient's documents, and then I'll send an e-care plan off to CPESN documenting that we did the opioid education and that we offered Narcan. So it sounds like a lot, but it really doesn't take that much time. We've kind of gotten to a groove of doing it, and everyone has just been able to kind of incorporate that into workflow now. But it's something that we do that I think protects both us and the patients.
Yeah. So, I mean, I saw Joe Moose speak about this at NCPA this year, I guess back in October. And I thought it was really, really neat, just how detailed that documentation that, they were using a care plan for that documentation and documenting not only what they dispensed for reporting purposes, but documenting what they didn't dispense and how they had taken those mitigation efforts. But I think when you put that extra emphasis on those high risk prescriptions like that, you're also, creating an atmosphere for your patients where they know you care, they know that you take this seriously, and also, where anybody who maybe is a bit, nefariously filling prescriptions, knows that that's not going to fly at your pharmacy. And it's also well documented that, again, you're also covered, in the event of an audit or anything like that. So I think that's pretty smart. It seems like every pharmacy should be doing that at this point.
Yeah, I mean, I think so too. I think, like I said, it just provides that extra layer of protection and lines out clearly what the expectations are, because the patient isn't going to know unless you tell them. And the fact that they're actually signing a document that says that they understand what those are, that's something that we have referred back to with patients, especially patients that are trying to fill up multiple pharmacies. We can say, no, you signed this document that said that you're going to fill everything here. And that's how we can protect and make sure you're filling, the right medications at the right time. So we've definitely been able to utilize that. I wouldn't say as like leverage, but as something that we can show back to our patients if it's broken.
Yeah, and for sure. It's kind of funny now. Like I think of somebody who's been in pharmacy for a long time. It just kind of reminds me of that movie, like There's No Country for Old Men, where and the past 5 years, just the landscape of COVID and the opioid epidemic. I mean, low reimbursements. Man, it is a difficult time, and it's kind of a crazy time for pharmacy. So, that's interesting, and it's also interesting. I think that if you do have somebody getting a normal opioid prescription for like a surgery or something like that, and, who's maybe not in tune with, the side effects of that. Just a couple years ago, it seems like we were, not as cautious as we should have been.
Yeah, I think for sure. Now, with those patients, we don't make them sign a pledge right off the bat unless they're started on chronic therapy, but they're always patients that we will verbally counsel just because of the side effects, especially if we see someone's new to opioid therapy. Definitely the do not drive, try and avoid alcohol. Like if you're going to take this, go home and take it and see how your body reacts. Be careful of taking it scheduled and long term. So I think that verbal counseling there that they may or may not have gotten from their doctor's office is so important in trying to prevent that long-term use.
Thanks for listening to this clip from Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.